Welcome to the seventh episode of Colgate-Palmolive's educational health series, Get to Know Your OQ with Colgate-Palmolive. My name is Dr. Maria Ryan, and I'm Vice President and Chief Clinical Officer at the Colgate-Palmolive Company, and your host for today's episode, where we will be discussing the important work being conducted by Dr. Hugh Silk and his team to improve oral health education in medical and primary care residency programs, as well as in nursing and other allied health schools, ultimately leading to improved oral health literacy and better oral health for people throughout the United States and in other parts of the world. It's my pleasure to introduce this episode's guest, Dr. Hugh Silk. Hi, Hugh.
Hey, nice to see you.
I have to quickly introduce you, although the resume is very long, so I'm going to try and make it a little brief here, but Hugh has a very distinguished career. He has an undergraduate degree from Harvard University, where he majored in government. He attended medical school at McMaster Medical School in Hamilton, Ontario, Canada, with a residency at the UMass Chan Medical School Family Medicine Residency Program in Worcester, Massachusetts. He has a Master's of Public Health from the Harvard School of Public Health, and he currently serves as Vice Chair of Community Health and Professor at the University of Massachusetts Chan Medical School, and is a Pathway Director for Structural Inequity, Advocacy, and Injustice. He is a Learning Communities mentor at the Blackstone House and instructor at Harvard School of Dental Medicine, which I have an affinity for, and very good friends and great work that's ongoing there. And he is the director of Mass AHEC Network, which is the Area Health Education Center, and the principal investigator at the Center for Integration of Primary Care and Oral Health, better known as CIPCO, which we'll be talking about in just a moment. And he is a past recipient of the American Association of Public Health Dentistry Public Service Award. So welcome, Hugh. You have an incredible body of work that has focused on interdisciplinary approaches to address oral health problems. And as a physician, I think probably many people are very curious about how you got involved in this very important work.
Yeah, no, thanks for that kind introduction and for that question. You know, I was a resident in family medicine, as you mentioned, at UMass back in the late 90s. And what I was seeing in Worcester, Massachusetts, were a lot of children with poor oral health. And then when I started to look more in the mouths of adults, especially those who are hospitalized, I noticed poor oral health. When I turned to my faculty members who knew everything about everything, this was the one topic they didn't know anything about. So I took it upon myself to learn more, started teaching others. And over time, this became a national curriculum. I was fortunate enough to find some other folks so that faculty members no longer would have to say, I don't know. We could train up faculty members to be able to teach all residents, medical students more about oral health.
Yeah, you know, Hugh, I taught for 20 years in a health sciences center, and I saw that same disconnect, you know, between oral health and overall health and well-being. And I think that it's probably prevalent not just only in our country, but other parts of the world as well. And so this curriculum that you have created for medical schools and other health-related professions is called Smiles for Life. And I think it's wonderful because it really helps to address this issue that we face. So can you tell the audience a little bit more about the Smiles for Life educational program? And I know you've had many, many people from all over the world really kind of plug into the program that you've created.
Yeah, again, there was a number of originally family doctors who were interested in trying to create curriculum. There was some national government funding originally to create curricula, and then no one knew what was going to be next. So we all came together. We were fortunate enough to partner with CareQuest, which was Delta Dental, or which was DentaQuest then. And we created 8 modules across the lifespan. So whether you're talking about infants or whether you're talking about geriatrics, whether you're talking about prenatal care or you're talking about urgent care issues. And we teamed up with nurse practitioners, physician assistants, dentists, pediatric dentists, and said to ourselves, we have to make this as practical as possible. We're not trying to turn medical people into dentists. We're trying to get them to be able to ask the right questions, look in the mouth, give some thoughtful advice, and make a proper referral, as well as do anything they can in their office, like fluoride varnish. And so over time, what we have found is this has been downloaded over 3 million times. This is used in every state. It's used in other countries. We even have a Canadian version of it. We created an app so people could download information and keep it on their phone. We created questions and games. And so this is really being used thoughtfully in many medical schools, nurse practitioner schools, residencies. So it's been a really successful endeavor.
That's fabulous. And, you know, I realize also from this spawned other work that you are doing. And I mentioned before the Center for Integration of Primary Care and Oral Health, or CIPCO. And that led to the 100 Million Mouths campaign across the United States. And so I'm sure not only me, but the whole audience would love to hear more about your progress towards oral health integration into primary care settings, especially this month as we celebrate Nurses Month. It's in the US. I don't know if it's international. I believe it may be International Nurses Month, but I know in the US, because I believe that nurses are playing a key role in this campaign as well. And you mentioned the nurse practitioners as well, being involved in the programs that you're working with. So let us know what you're doing there.
Yeah. So again, what's happened with Smiles for Life is our Cora has taken over as the funder. Meanwhile, CareQuest is helping our endeavor as to how do we get Smiles for Life into as many schools and residencies as possible. We call it 100 Million Mouths campaign because, as you and your audience know, over 100 million people every year do not get to see a dental professional, which is very, very, very sad. We have capacity issues, we have insurance issues, we have location and geography issues, we have racial issues. And so in the meantime, there is a lot that primary care can do. So we're trying to get to all 50 states. Right now, we're in 22 states. We're training up a champion in each state, a champion from someone who can engage with primary care, whether that's an osteopath school, a midwifery program, even as broad as a community health worker program, but of course, medical schools and pediatric residencies. And then get into the curriculum a certain amount of oral health with a health equity lens to it, with an eye to sustainability. So training up faculty so the champion doesn't have to keep coming back. And over time, if you think of all the people that will graduate from those programs and schools, we hope that those 100 million mouths that are out there, those 100 million people that are out there not being able to see a dental professional, will get, again, proper history, proper exam, good advice, preventive advice, perhaps fluoride varnish where needed, and then a referral to dentists as able, and hopefully we'll keep ramping up the kind of care we need in this country. So that's why we call it what we do. And we meet with our champions regularly, and we keep training them and really being cheerleaders and coaches to get them into all those programs.
Yeah, that's fabulous. And in many parts of the country, they may be the only people that they have access to who can really address oral health issues and talk to them about it, and then try to find them places where they could get additional care, which I think is really, really important. So, you know, the work that you're doing is important to the mission of the Know Your OQ, or Know Your Oral Health Quotient program, which we've developed to really try and improve oral health literacy worldwide by informing the public about the importance of oral health to their overall health and well-being. Because we feel, you know, you have to bring the people into this. They have to be interested in it. And you've brought the other healthcare professionals into this as well, which is so important because we need all the help we can get to spread this message. And, as part of the Know Your OQ program, we also talk to people about the signs and symptoms of disease and the preventive measures that they can take, which is also what's being promoted by those in your program. And then also we work on increasing awareness of the importance of seeing oral care providers and the options that can improve upon access. And certainly your 100 Million Mouths campaign can help to address all of these goals as well. So we consider you a partner in achieving the goals that we've set for ourselves. And so I'm really thankful that you came here today to join us for this program. And I'm glad that we were able to connect and to share some of the work that you're doing to improve on oral health training of healthcare professionals across the disciplines and to put public health programs into motion that deploy numerous healthcare providers to improve on oral health literacy and to identify and better manage oral health issues within our population. So one of the things that I ask all of our guests to do before we close is to share some of the takeaways that they would like people to get from today's conversation and maybe some actions that they can take. So Dr. Silk, what do you think people might be able to take from our discussion today?
Yeah, I like that you use the word partnership. I would say we don't always do that well, but I think we're heading in that direction with accountable care organizations and value-based care, where we think of the patient first and foremost and how we can keep them healthy. So I guess I would say know that we are really trying to train up medical professionals of all sorts to think about oral health, to think about the effect of oral health on the body and vice versa. That hopefully these new graduates will be engaging people on that front, and they want to work with the dental professionals. This isn't a us versus them. This is a, I can do a certain amount, but I need your help as well. And I think if we both think about what you said with the sort of OQ movement, this idea that even if people see a dentist twice a year and they see me a few times a year, there's still 360 days out of the year that they're not with either of us. And so we really need to get them trained up on signs and symptoms and prevention. And we can do this together, I think, much better than on our own.
Yeah, I agree with you, Hugh. And we know that in the United States, only about 50% of people actually get to a dentist.
Right.
So I think your program can be very impactful in educating them and getting them to the care that they need and may not know, because many people don't actually have signs and symptoms. Unfortunately, many of the diseases that we treat are often silent. So you need others to help identify disease as well. So thank you so much for coming. And I look forward to working with you and your team. Anything we can do to help out, we would love to do that.
Thank you.
Take care.